A federal inspection report finds health startup Theranos ran blood tests during a 6-month period despite erratic quality control results. WSJ reporter John Carreyrou has been following this story and joins us now with an update. Hi, John. Great to see you.
Hi, thanks for having me.
So tell us what is in this report exactly.
So this is a report that was referenced in a letter in late January by the agency, the federal agency that did the inspection, the Centers for Medicare and Medicaid Services. And we found out that the actual report, which hadn't been made public yet, lists a series of problems, one of which arguably the most serious one, or one of the most serious ones, involves this blood test. It's a test called prothrombin time, and it's a test that measures the speed at which blood clots. It's a test that's very important to patients who are on the blood thinner warfarin. The blood thinner warfarin is used for patients who are at risk of strokes, and you get this prothrombin time test to see whether you have the right dose of warfarin. So it's a vital test for that one category of patients.
So let's clarify something, though. This report is talking about a basic laboratory test, right? This doesn't have anything to do with Theranos' technology.
Right. This test was actually performed by the Theranos lab in Northern California on a Siemens machine, a commercial analyzer that's FDA approved and that any laboratory can buy. So the test that is at issue here and that had these quality control failures has nothing to do with any Theranos proprietary technology.
So does that seem to suggest that the lab itself is not being well run?
Well, certainly the inspectors found a lot of problems in the lab. The prothrombin time test was part of a category called hematology that the letter from late January said was the biggest problem area. The agency said that the problems in that area posed immediate jeopardy to patient health and safety. But there were also 4 other categories that were listed in that letter. And we have since learned from people who have seen this inspection report that the other categories included the laboratory director not having responsibility or oversight for quality control in the lab, which is not the way things are usually done in a lab. Usually the lab director has ultimate responsibility for the quality control in a laboratory.
So interesting. Now, will this full report become available to the public?
Well, that's an open question. Normally, CMS, the agency that did the inspection, considers these laboratory reports to be public information. And when members of the public or the press ask for them, it usually releases them. In this case, Theranos is arguing that the agency should not publish it because the report, which is lengthy, more than 100 pages long, I'm told, contains trade secrets, according to Theranos.
So if it is released, it might be heavily redacted.
That might be a compromise that's reached between Theranos and the agency.
Has Theranos yet commented on this report?
Yes, it commented to us yesterday and then has since put a statement on its website. It says that it has remedied many of the problems that inspectors found during that inspection and hired a new lab director. It also says that it doesn't think that the prothrombin time results affected patient health.
Okay.
When I talk to laboratory directors, independent laboratory experts, they say that ignoring or disregarding quality control failures for that test for 6 months is virtually unheard of in a laboratory, and that it's very dangerous, that the health consequences for patients can be very grave.
And so is Theranos still allowed to run tests? What's going on at this moment?
Oh, right now, Theranos has been told by CMS that it's under risk of losing its certification if it doesn't remedy all the problems promptly.
At risk of losing, but...
At risk. It still has its certification right now, and it has filed a formal correction plan to the agency. Theranos has also told Walgreens that it's running some tests it's having third-party laboratories run some tests, and we know from having seen some patients' results that since the fall or the beginning of the winter, this test, in particular the prothrombin time test, is being outsourced to a laboratory in Utah.
Okay, well, John, we know you will continue to follow this story closely, so thank you so much for that.
I will. Thanks for having me.